Peace be upon you. Fractures of the femoral neck. This type of fracture is, to some extent, a bit troublesome. It can happen at any age, but it is more common in older people. The problem with this fracture is that it needs to be stabilized quickly because the blood supply to the hip joint, specifically the head of the femur, decreases. So it is preferable to stabilize it within the first 12 hours, or at most within the first 24 hours. Femoral neck fractures usually result from trauma, often from accidents, or in elderly people from a fall. For example, slipping and falling. There are many ways to fix this fracture because it depends on whether the bone has shifted or if it has remained in its place. So if the femoral neck is still in place but just fractured, it can be fixed with plates and screws. But if the fracture has shifted far away from the joint, or if it has become dislocated from the joint itself, then in most cases with older patients, we have to install an artificial joint. If the older patient is, for example, over 60 years old, but in younger patients, we might try to fix it and give it a chance. Will it heal or not? Because in younger patients, you might be 30 years old and not want to replace the joint. So we have to use something called cannulated screws, or what's known as a DHS, which is a dynamic hip screw. These fractures are followed up for 6 weeks afterwards. If the fracture heals, then that's great. If it doesn't heal, then we go back to considering joint replacement. But the most important thing in fixation is the speed of the operation. If the fracture occurs, the speed of the operation is crucial for healing, and actually, there are other things I need to discuss in detail. God willing, I will talk to you about them in detail in a new video. Peace be upon you, and God's mercy.